Did you know that thyroid medication can be a giant diva? She needs to be the only thing in your stomach if you're taking thyroid medication and very much away from certain foods, nutrients, minerals, and more. Listen up, hit that subscribe button. I'm Dr. Carrie Jones, a women's health and hormone expert who loves answering your questions. I got this question just the other day. Hi, Dr. Carrie. I'm on thyroid medication and recently found out I shouldn't be drinking it with my coffee and cream. Is this true? It is true. I am sorry to tell you. I guess I should say it's true-ish. Here's why. Thyroid medication, if you are on any combination, T4, T3, any kind of prescription glandular such as Armour, thyroid medication, her absorption can be difficult if you're also taking your medication with an antacid or anything for heartburn, of course. That'll block most all medications, so be careful with any antacid you take. Certain minerals, calcium, magnesium, and iron, and calcium, magnesium, iron fortified foods. So this could even include if you take your thyroid medication and then have a bunch of dairy products. So dairy products are largely suggested by pharmacists. Don't swallow your thyroid medication with dairy products, which includes coffee and cream, as this person asked. Also be careful of coffee and tea itself. The phytates in it can bind and compete with the thyroid medication. And fiber, I do keep reading over and over, if you're doing something high fiber, whether it's a fiber supplement, a fiber powder, or you're using ground seeds or something fibrous, a fiber cereal, a fiber bread at the same time. Now, what does this mean? This means that you may have to take more of the medication if you're going to take these other foods and supplements at the same time. So if you're not willing to give up coffee and cream when you swallow your thyroid medication, then always swallow your thyroid medication with coffee and cream. Therefore, when you get your blood work and you're getting managed, you stay same. If you choose to be away from your coffee and cream, you may find over time that you need less thyroid medication. You may not. It may change. But in general, when you read the pharmacy sites and the medication sites, the answer is yes. You want to take your thyroid medication, ideally, on an empty stomach, away from this whole food list I just said, for probably a good hour, maybe more, which I know can be a pain for a lot of you taking thyroid medication first thing in the morning, but at least try to give yourself a good hour buffer, according to my pharmacy friends that I've talked to over the many years. Now, here's some other interesting facts about thyroid medication and thyroid testing in general that go along with this question. If you still cycle, if you still get a menstrual cycle, and you still ovulate or release the egg, there is some research to suggest that your thyroid level, called TSH, thyroid stimulating hormone, can go up 1, 2, or 3 points at ovulation. Now, this is a big deal. This means if you're going to get your thyroid hormones checked because you're on thyroid medication, that if you go around ovulation, that TSH marker may be higher than you are at other points of your cycle. It doesn't necessarily mean you're hypothyroid or you have a thyroid problem, but it could mean in the act of ovulation, where every hormone seems to be going up at that time to release the egg, that TSH also goes up. Now, the research isn't super strong on this. I have seen it in clinical practice several times over. So when I suggest women go get their thyroid tested, that they do so in the morning and not around ovulation if you still cycle. So do it around your period, do it in the week leading up to your period. Just don't do it in those few days around ovulation. And you want to be consistent. So every time you get your thyroid hormone checked, make sure you are consistently away from ovulation, because you don't want to be accidentally told you're hypothyroid when you're not. You're just ovulating. It's possible it's affecting you. So I think that's a really neat fact about the female body. If you're postmenopausal and you don't have a cycle, then you don't have to worry about this. You can get your thyroid tested at any time. But I feel like these little clinical pearls around thyroid can really make a difference because they aren't commonly taught or discussed. Your pharmacist may not have time to run through these little nuances, but I want you to make the most of your thyroid medication. I want it to work the best for you. So avoiding those foods, antacid, heartburn, minerals like calcium, magnesium, iron, don't Don't swallow them at the same time. Dairy products, I'm so sorry, coffee, tea, and then fiber at the same time. You want to give a buffer. Try to give at least an hour buffer if you can. And then when you go for testing, try to do it at your period or the week leading up to your period, not right at the center if you're still ovulating. If you're not ovulating postmenopausal, then you can get your thyroid drawn at any time. So I hope this video was helpful. Make sure you hit that subscribe button. Please keep the questions coming. I love answering them for you.